Good afternoon, everybody. My name is Jackie Groenewegen, and I am the owner of Mindful Wellness Medical Thermography in Westchester, Ohio. And my practice is also in Westchester, Ohio. And right now we are at WIN, the luncheon for WIN, which is Women's Idea Networking in Westchester, Ohio. So thank you for hosting us for that. So I'm going to talk to you for a few minutes about thermography, medical thermography. And that is what Jen and I do. My lab is certified by the Professional Academy of Clinical Thermography, and underneath them is Breath Thermography International, and that's who I work for. So thermography is, first of all, I'm going to tell you what thermography is. It is thermal imaging. So that means there is a very sensitive thermal camera that takes images. And what it does is it captures temperature differences in the body. So it is normal to have certain areas of the body that are warmer than other areas. For instance, in the crook of the neck, it's warmer, in the elbows, behind the knees, under the breasts, in the groin, etc. Those areas are all normal to be warmer. But there are, when there is disease or pathology or inflammation, those areas typically show up as warmer. So you can see, as an example there, where that red is, that's an example of where that person might have some inflammation. Or perhaps there's a lack of heat. That can also be indicative of a pathology. So that's why it's so good to have you get that whole map. Everything is mapped, and it's done. Well, we'll continue. I'm going to jump ahead here. Those are, okay, some of the benefits of medical thermography. It's full body thermal imaging, breast health screening, thyroid screening, lymphatic congestion shows up, abdominal inflammation. There's a whole vascular system analysis because you can see if there's varicose veins or problems there. Neuromuscular disorders, muscular disorders, vascular screening, as well as a host of other things that show up in the scan. Okay, so one of the big things that's a big plus about thermography is that there is absolutely no radiation. There are two reasons why a woman doesn't get a mammogram, and that's either because of the compression, the squeezing, which can be so painful for some women, or because of the radiation. So with thermography, there's neither. There's no contact, you're behind a privacy screen, and there's no radiation at all. So anyone can have it done. A newborn can have this done, a pregnant woman, nursing woman. There's no contraindications whatsoever. So this is a poor fuzzy picture, so the pictures are much clearer than this. But we can see these are two scans of the same person taken 6 months apart and show that her cancer is advancing. So you see here in her left breast, there's no heat at all. But when we go over here, you can see the difference. And that was only in 6 months. And the images are taken in two, what they call palettes. They're the color palette and then the grayscale. In the grayscale here, you can see all this vascular activity, and that is inflammation that's showing up there. And here you can see it's exactly the same image, just flipped back and forth from color to grayscale. So you've got the inflammation showing up there as heat, and here is the vascular activity. So chances are good that there is cancer in here, and it's being fed by extra blood. That's how it spreads. There are little blood vessels going to it. That's called angiogenesis. We don't have to get into that right now. Okay. So not only, when you get a scan done, it's not only screening the breast, but it's also screening the whole body. So with her, you can see, which is also really typical, is oral inflammation. And you can see, do you see how it's dark around her mouth like that? That's all inflammation. And we know, you've all heard about the correlation between gingivitis and heart disease, right? So you can see, here's a good example. You see how this bacteria is kind of dripping down lymphatic channels from her oral area, and in her case, straight to her right nipple. I've seen other scans where it will flow straight into someone's liver or any other organ. So it is it is not just something dentists say to get more money or whatever. It really, truly is true that oral inflammation is not good. You've got to keep on top of that. It's very important. So all of the, I'm the technician. I take the images. The images are sent off to the doctor's office, and over the course of a few days, 3 doctors will review your images, and between the 3 of them, they will put together what's called an interpretation and a report. One doctor that reviews all scans is Dr. Alexander Sepper. He is a gynecologist with over 30 years of experience, and he also happens to have a PhD in thermology. So he overviews every single scan. So in her case, you can see how proactive lifestyle changes can improve your health. So in her case, she had an inflammation there and some vascular activity that correlated to that heat there. And here, she's been doing her lifestyle. She's got to do her work. A lot of what is picked up in thermography are precursors to disease. They're not there yet. So lifestyle changes almost always reverse it. Not always, but almost always reverse it. So that's why staying on top of your health is so important. So she got busy. She got a wake-up call, and she saw what was going on there. So she took action, and within, I'm not sure what the data, I think it was a few months as well. Huge difference. And that's reversed now. She doesn't have to worry now. That's huge. That doesn't mean she's done, sadly. You have to keep doing healthy stuff. Okay. It is a safe adjunctive screening method aiding in the diagnosis of disease. So for some doctors who are really holistically minded, they encourage their patients to do thermography. Some doctors who are more allopathic will be okay with it being adjunctive or in addition to other testing like mammograms, MRI, ultrasound, whatever is needed for it. And it oftentimes, when something shows up through a thermogram, further diagnosis might need to happen as well. It depends on what's going on. So with her, this is this lady. I think I showed you guys this picture last year. This is what her back looks like thermographically 15 minutes after she's taken off her bra. That's what's going on. That's her bra is so tight. All of this red stuff, all this here is congestion. So she is starving her breasts and her back all day long of blood and lymph. That is not okay. So when you get home, number one, please get properly fitted bras. That is so crucial. And at the end of the day, when you come home, take your bra off. Give yourself some breast massage.
Why do you have to tell us that? That's how you're coming. Why?
Good. Shower. That's good. Yeah. Good. Give yourself some breast massage afterwards as well for breast health. It's so crucial. Okay. Okay, so we do have a referral as well. Refer one person and you get $25 off your next screening. It can be your first screening, and there's no limit to how many times you can do that. 10 reasons. It detects cancer early. There's no radiation. It's painless, no compression, no contact, convenient. You can start, they recommend it starts at 20. Now, an interesting thing, the standard of care says mammograms start at 40. There are plenty, sadly, so many aggressive cancers that are showing up in very young women, but there's no screening for them. What's wrong with that picture? They're just left on their own because their insurance won't cover it unless there's some extenuating circumstance. Well, how would they know that? So that's why that makes no sense. So we like to start thermography at the age of 20, and it detects areas against the chest wall and in the armpit. And now we're going to do some malware. Okay. And it checks lumps and positive foundings found on a mammogram. Okay, so if you've got a lump or a cyst somewhere in your body, and if it doesn't even show up on your thermogram, that means the thermal camera doesn't see it. and that means there's no heat there. That means it's not metabolically active. That means it's nothing. So that's good to know, right? Instead of having another test, and you can have as many tests as you want because there's absolutely no contraindications. University of Wisconsin study, huge important study, showed that 70% of tumors can be identified on a thermogram up to a decade before a mammogram. That gives you 10 years notice. So I was telling this story of something that was really super exciting. I thought it was really super exciting. The woman at the time wasn't so excited about it, but she had her thermogram follow-up, according to what the doctor said, and it had worsened. But it had just flipped, meaning that last time, 6 months ago or whatever, it wasn't hot. But there's this spot now that flipped and it's hot. Does that mean it's cancer? Not necessarily, but it means that we have to get on it. So she was very worried. But I'm excited because we caught it just as it flipped. That's huge. So you got to get busy. Get with your integrated doctors. Get with your diet plan, because so much of this can be reversed by what you're eating and your supplements and all that. It's so key. So key. Okay, so we are doing this. This is breast health awareness season, as you know. So this is our big push for September and October. So, and you guys will all have access to this, and you will have this coupon as well. $25 off a breast scan, $35 off head and torso, and $50 off full body. The best discount of the year. So I only have a few minutes left, and I want to make sure that if there were any questions, that I answered them. Does anyone have any questions or things that they would like to add? Yes, ma'am.
How does the traditional medical community embrace this in terms of insurance providers and that sort of thing? Is it gaining any steam?
Baby steps. Yeah. It is baby steps. So there, what I'm noticing is that the doctors, the allopathic doctors who have a lot of women who are really educating themselves on alternatives, and they're demanding that they refuse to get a mammogram, a lot of those doctors are saying, okay, well then do something. So, okay, then get thermography. If you're not going to do mammogram, then at least get a thermogram. So I'm seeing that because their patients are demanding it. Sometimes some docs are really stuck on the standard of care, and you know, what are you going to do? That's what they are. But more and more of the integrated doctors are really pushing this, so this is really exciting. Yes, ma'am.
Where's the cost?
A breast scan is $249. That's before the discount. Head and torso is $329, and full body is $499. Okay, so that includes the interpretation. It does not include the consult. That's optional, and that's extra.
And then do you get a copy of your results to take to your primary care physician or your neurologist who you're working with, or do the doctors send it right to them?
Yeah, great question. So when your report is ready, you are notified that it's ready. You will have two choices. You can either have your interpretation or your report sent directly to your doctor, which unless your doctor is super holistically minded and knows what to do with inflammation, I don't recommend. The other choice is to have a telephone consult with an interpreting thermologist, who is a doctor who does this all day. They're the expert. I always recommend do the telephone consult. And then what happens is you set up a time with them, they call you, you get the report, you're looking at it on your computer, you're talking to the doctor on the phone, and then you've got a copy of it. So afterwards, you can send it to whomever you want at that point. But you really need to have someone explain it to you, an expert to explain it to you, because they're going to go over it. You're going to get all of the images. You're going to get the interpretation, and the doctor's going to say, okay, this is what we found. This is what these are areas of concern or not. This is what you need to do, and this is when your follow-up should be. And the follow-up is so crucial that you listen to that. They're not just pulling numbers out of a hat. It's because it's all based on science and where you are in that moment. Any other questions?
I'll never be able to say it. This test reminds me of thermography when I saw it.
When did it all really come out?
It was born in the 50s.
Really?
It was FDA cleared in the 80s. Okay, so it is FDA cleared. And it's just becoming more and more mainstream as more people realize that going the holistic integrated way is probably the better choice. You know, it depends on where your mindset is. Yeah.
So how often do you recommend having scans on you? I've heard you mention 6 months and a year. What?
I get, now this is me, I get a breast scan done mid-year and I get a full body scan done mid-year. That's me. But it's always based on what the doctors say. So sometimes, oftentimes what I notice is someone comes in, the doctors prefer if your first one is a full body. And the reason for that is so that they can start to establish a baseline so they can compare things later on. So what I've often seen happen is that most American breasts have inflammation. I've seen one breast without any inflammation, and that breast had an implant in it. So we live in a toxic world, and I don't know why it is, but breast tissue is just a magnet for toxicity and inflammation. So I often see that she'll be given a ranking, and they're going to point to areas of concern, and they might say, depending on what they find, we want to establish a baseline in 6 months with you based on what we're seeing. And then after that, if everything's fine, it would probably be annually, if you're talking just for breast screening. Now, there could be a host of other things going on in your body as well. But does that answer your question? Okay. Any other questions? Does everyone have a good handle on what thermography is? Yeah.
So you talked about how the thermography breast scan can be compared to a mammogram. What about when you get a thermography head scan comparative to an MRI for detecting brain tumors?
So deep in the brain is harder for thermography to pick up because it can't see through the skull. Oftentimes with the deep pathology, the heat radiates to the surface. So I couldn't answer that question completely accurately, other than to say one of the things that we saw was that on one patient, one side of the forehead was much colder than the other side. So that says lack of circulation, right? And that patient was called and said go directly to the ER. The person did not go to the ER. They went to their doctor. The doctor poo-pooed it, and he had a stroke and died. Any other questions, comments?
Jackie, if we were to find you for more thermography,
Thank you, Michelle. My practice again is in Westchester, Ohio. My website is MindfulWellnessMedicalThermography, and my phone number is 513-382-3132. Thank you so much. I really appreciate your attention, and I am always available. I will always happy to talk and answer questions. Absolutely. Thank you.